is Jennifer Blanchard. She is the chief pharmacist at the VA. She was preceptor of the year last year for the Augusta area. Students last year absolutely loved being at the VA. They have so many options, and this year even more than last year. So let me pull this up because I did update the sheet. So
it's still evolving, I think.
It's still evolving a little bit. We've added from the sheet because I sent this out to everybody yesterday. I think the things that I added, we do have one more person. Is she still doing women's health?
For primary care, it's primary women's health and as well as traditional primary care.
And then anti-coag. Okay. So we have a new preceptor. The availability, she turned it in already, yes. So it should be in there between today and tomorrow. And then we went ahead and added
yes.
Jim. Did you say there was one more?
Yeah,
person?
Dr. Layden and Dr. Wagner are combining to do an acute care inventory management pharmacokinetics. They're filling out their paperwork as we speak.
Great.
So it should also be available later today.
So maybe you could just speak to that one since that one's not on the sheet, but you can. Thank you.
All right. Well, good morning, everyone. Thank you for your time and attention to this. We enjoy the opportunity to come over and talk about rotations. I've been doing this for a long time here at Charlie Norwood for about 3 years, but I found over my career that when you come and talk in person, you tend to get a better response. People have a little bit more of an understanding of what the rotations are like. So we're going to divide and conquer this morning, and I'll focus on more of our acute care and our institutional type rotations, and then I'm going to let Kirby kind of cover the one that most people get excited about, and that's the AM care, because the VA does AM care right. So we'll kind of divide and conquer this morning. Little plug for us. We're excited to have so many opportunities. This has been a growing program for us, and we really look forward to having students in our program. We feel like the VA is such a unique and exciting practice environment. As pharmacists who've chosen to have our career there, we know that we get to do a lot more with our license and our credential. Most of us have a scope of practice. We can practice autonomously. We're very actively involved in the patient care program. So it's a pretty exciting opportunity for us to share that kind of practice with you guys. So I'll focus on some of the things that we offer in the acute care arena. Of course, we have your average acute care internal medicine rotations. We've got multiple preceptors that offer that. We've got Melanie Siv, Crystal Cha, Angela Walton. They offer a traditional internal med. So you'll be rounding with the team, you'll be deeply involved in the process, you'll get a lot of opportunities to see all the cool and unique things that come into the hospital. That was my wheelhouse. I'm an acute care girl, loved internal med, like to see the weird stuff that pops up, like to have to deal with everything. And our veterans are great at providing us with weird stuff. You learn about things that you never thought you'd ever encounter in your life. So that's always a popular opportunity. Dr. Simmons is our critical care pharmacist. So she offers a traditional critical care rotation as well as some surgery coverage. So we have a mixed model critical care with surgery and general medicine patients as well as a cardiac step-down unit. So you get a little bit of everything. And then she also supports our surgery service. So you'll get kind of a mixed bag with her rotation with that traditional critical care experience where you've got the patients on the ventilator, the critically ill, you're worried about keeping them alive for today, and then you worry about the next stuff. So that's always a fun and exciting opportunity for folks. A couple new ones that we have to offer this year. Dr. Patrick Tu is our antimicrobial stewardship infectious disease pharmacist. So this is a new offering for us this academic year. If you're not familiar with antimicrobial stewardship, it is a critical element to a hospital program. We all like to think that antibiotics are prescribed correctly and appropriately for the right duration for the right patient, and that's not true. And so having him in this role, providing that surveillance, providing that guidance, providing that education, as well as working on new initiatives for us to use them safely and appropriately is a really fun new opportunity for us to offer that. We do also have Kirby's counterpart in the spinal cord injury unit. It's an inpatient spinal cord injury rotation. I think she's on here.
Who is that?
Oh, no, she's not. I'm sorry. I don't think Teresa, she's new in her position, so so I apologize, she wasn't ready to offer a rotation yet. But through some of our others, for example, if you take my administration rotation, you'd have an opportunity to rotate with some of these other preceptors. Her practice is fairly new, so I do apologize, I forgot, we offered her a little grace to establish her practice before we asked her to take students. So those are our primary acute rotations. I can speak a little bit to our hematology oncology as well. Laurel and Frankie is our hematology oncologist pharmacist. So that rotation works very closely with the oncologists and helping our patients ensure that we have safe and appropriate therapy for them. The VA is lucky in the fact that we can offer a lot of oncology services to our patients, and unlike private sector insurance and things like that, we don't have some of the same barriers to jump through to provide some of these novel and unique therapies to our patients. So you'll get exposure to some of these emerging processes over there. So that is certainly an interesting and dynamic field if you're looking for that kind of practice.
Is this more inpatient or outpatient?
It's more of an outpatient because it's the infusion clinic,
Okay.
so it's mostly outpatients that are coming in for their treatment. So it's working with the providers to establish the regimen. Laura Lynn does a lot of the building of the order sets, building of the regimens, because I think most of you know that there's usually a very structured approach to most of these oncology packages, and so making sure we have the right med, the right pre-meds, the right post-meds, that all increases the success for the patient. So it's primarily staged in our outpatient infusion clinic, but occasionally we'll have inpatients, or we'll deal with some of our care in the community patients that are receiving their care from Augusta Oncology but come back to the VA for their oral medications. So we do a lot of case management in that regard, where we have to check and make sure that all the appropriate labs are done, that the patient doesn't have drug interactions. So that's kind of an added complexity to the role, because you have to deal with outside providers, do some information gathering, really spend some time getting to know those patients to make sure that it's safe and appropriate. So I think, do you want me to speak to mental health too, or?
It doesn't matter.
Okay. Well, let me cover the administration rotations, and then we'll turn it over to Kirby and let her kind of cover the rest. We have a couple of different administration rotations, and I know everybody gets excited about that one. It's so sexy and glamorous, but really, during your rotations, it's a perfect time to get a little exposure to administration, because what you will find in the pharmacy career is your clinical or your administrative, but a lot of times they overlap, and that's how the career path goes. So it's always good to have a little bit of exposure to it as a student to decide if it's something you like before you end up being an administrator with no experience. So we offer quite a few options. We mentioned earlier that our institutional practices will be posted soon. Dr. Carswell is my Associate Chief of Operations, so he's responsible for our frontline programs in inpatient, outpatient. The C-Box does a lot of the day-to-day practice, so you really get a feel for how hospital pharmacy and outpatient pharmacy works, as well as some projects dealing with policy, procedure development. The students that he had in the first block spent a lot of time on USP 800 and all the implications that come along with that for our practice. So you'll really get a chance to kind of get a feel for what the running of a pharmacy department looks like, and what's involved with that day-to-day operation. So that's a great opportunity for folks that want to kind of see that side of the world. We mentioned too that Dr. Layden and Dr. Wagner, who are going to be two new preceptors, are going to offer a combined acute care, pharmacoeconomics, procurement type rotation, where you'll spend a little bit more time in the inpatient section. I know many of us don't get much exposure to acute care and inpatient practices unless you work in that, so it's a great opportunity to kind of see what hospital pharmacy looks like, things like USP 800 and 797 and how that translates into day-to-day operations. Those guidelines keep changing and making our life more and more complicated, but even down to unit dose delivery systems and how do you make sure we have what the patients need when they need it. And then with Dr. Wagner's side, pharmacoeconomics and procurement, you'll get a feel for what that looks like. Again, just like everything else, there's all kinds of new regulations and rules with inventory management and having sole custody of the product. It used to be you could call a hospital and ask to borrow something, and they've kind of tightened down on that. There's all kinds of rules about how you have to account for that inventory, as well as cost savings initiatives and different angles that you can study with that. So I think that'll be a unique offering for us. And then lastly, I offer a admin rotation. So that's a rotation with the chief. And basically you get to see what it's like to be the chief. We spend a lot of time in meetings, interacting with other departments. We spend a lot of time putting out fires. We do a lot of different policies, procedures, programs. We get to interact with everyone. So you get a more global view of what it takes to run a department in a busy pharmacy. Just to give you some insight, we have 100 employees. We service 44,000 veterans in this area. We have a 2-division facility with 3 CBOCs, and we have lots of services we support. So every day is different, and you can't predict what's going to happen or what issue will be plaguing you. Yesterday my call was, can you give placebos in an acute care setting when you have concern about abuse or misuse of a medication? And the answer is no. But having to go back and find the documentation for that, and where's the guidance? Because obviously our interest is to take care of the patient, but we need to be ethical and follow the right rules and make sure we've dotted all our I's. So again, you're never going to know what you have to deal with or what you have to think about, so it makes it kind of exciting and fun. And so at that point, I'm going to turn it over to Kirby and let her talk, and we'll be available for questions.
Okay, can you guys hear me? The distance signs?
We can.
Okay, perfect. So my name is Kirby Benson. I am the spinal cord injury outpatient clinical pharmacy specialist. But I'm going to talk about all of the ambulatory care rotations like Dr. Blanchard mentioned. The VA does do ambulatory care, right? So I didn't do any VA rotations in pharmacy school, and I wish someone would have exposed me to that. I ended up participating with the VA in my 2nd year of residency, and now I'm here because I absolutely love the VA. So if you're even thinking about ambulatory care, definitely consider the VA. So we have several different specialty areas, like Dr. Blanchard already mentioned, ambulatory oncology. Then we also have anemia and hepatitis C with Dr. Augusta. So Dr. Augusta is responsible for assisting the GI department in choosing the appropriate hep C regimens for patients, identifying the drug interactions, monitoring the labs, following up with patients to make sure they're being adherent to their medications, and monitoring the response to therapies. It's a very unique rotation. I think she typically has a student almost all the time, it seems like. I think students really love that rotation as well. Another specialty is the mental health with Dr. Philip M. He is newer here within the last couple of years, but he has a scope of practice that he operates under as well, where he works closely with a psychiatrist, and he will talk to patients, interview them about how they're doing with different kinds of depression, anxiety, substance abuse, and adjust their medications accordingly under his scope of practice. So he's kind of independently doing some of those things to help service our veterans. So a lot of hands-on there as well. Another specialty, I think that's probably anti-coag. So anti-coag is probably what you think, anti-coag. It's a lot of patients that they service. So they do all the Coumadin monitoring, and then the DOAC, so your Xarelto, your Eliquis, all those kinds of things as well. Lots of the bridging type of situations. There's always some kind of urgent situation going on up there in the anti-coag clinic, I think. So if you're really ready to get your feet wet in anti-coag and you're really challenged, that would be a great rotation for you. Really kind of any pharmacy career that you go on, you are going to have to understand something about anti-coag, so that's really a great rotation. There's 2 preceptors for that just do anti-coag. That's Dr. Wayne Hadaway and Caitlin Brandt. Then we also have some other primary care pharmacists that spend some time doing anti-coag 1 or 2 days a week as well, so kind of a blended approach. And that's going to be Taylor Childress and Katie Doman. They are both primary care, so they're going to do your chronic disease state management. So the big things we think of: diabetes, hypertension, lipids, but then also things like COPD, heart failure, some of those ambulatory care sensitive conditions where patients keep getting readmitted to the hospital for the same thing over and over again. How can we as pharmacists try to help with some of those things? We're seeing them on the wrong regimens. If they come to us, we can change those regimens for them without having to get the doctor's approval. We don't have to track them down and say, hey, they're on the wrong dose of Symbicort. Can we change it? No, we change it. That's why ambulatory care is so great at the VA. So those two do a split, and I think Katie does also some long-term care as well. So she has a very hybrid kind of role: long-term care, anticoagulation, and then primary care doing that chronic disease state management. So if you're looking for a little bit of everything, her rotation might be good for you there. And then we have our typical primary care, where you are in the clinic, you're assigned, to several physicians. You have your own panel of patients, well, not you per se, but the pharmacist has their own panel of patients, to where they're monitoring those patients, predominantly diabetes, lipids, hypertension, COPD, heart failure, and sometimes any other crazy things that come up. I think Kirsty seems to get, it's under A, Kirsty French. She sometimes gets a lot of different things from her providers because they really trust their pharmacists and they trust their patients' care with the pharmacist too. So sometimes they might have hyperkalemia and they're like looking to the pharmacist to help manage that and follow up on those labs, that kind of thing. And then my rotation is spinal cord injury. So that seems a little bit scary, but it's not that scary. I do primary care in spinal cord injury, so your same kinds of things. But then I also do things that are very targeted to spinal cord patients, like bowel and bladder. So if you have a spinal cord injury, you have issues with some of those things. So sometimes adjusting their bowel regimens, like doctors say, senna, Miralax, all that good kind of over-the-counter stuff. But it really is kind of an art for those patients. We have a fantastic primary care physician in our spinal cord clinic, and she comes into my office like 10 times a day, it seems like. She's always in my office asking me questions about patients, asking me my recommendations for their pain medications, for their antibiotics, for their UTI, different kinds of things like that. So you get a lot of variety in the spinal cord injury clinic. I also work with the home care team. I follow about 80 to 90 patients in the home care program, and we do very thorough chronic disease state medication reviews, and this is where I'm able to see how things are going on a quarterly basis for patients, if anything needs adjusted, if labs have come back that haven't been addressed, where maybe a statin needs changed or held, like their LFTs are high, then I'm going to be responsible for that, and I participate with the home care team in different interdisciplinary meetings as well.
Lona.
Oh, Lona. Yes, so Lona Thornhill is going to have a combination rotation with another pharmacist, Andrea Bussey, and it's going to be a home-based primary care, so kind of that last part I mentioned, doing quarterly medication reviews, working with a home care team. So these are for patients that are really kind of homebound. They can't really get to the VA. They're in like a 50-mile radius, but the team goes out and sees them. I think there's some opportunities to potentially have some of that involvement, but it's also with the long-term care, with the geriatrics program as well. And maybe Dr. Blanchard can speak a little bit more to the geriatrics.
So geriatrics, we have, it's called a community.
Will you push the button on there so they can hear you? Can you push one of these black buttons?
Okay.
Push that so the people on the
Okay.
outside
So it's a long-term care facility. It's a community living center is the model that we have. So we have about 100 patients that are in that community living center. Most of them are there for either long-term rehab. Some of them are residents. We've had some that have lived there up to 30 years. And then we have some short-term rehab. So it's kind of a mixed bag, but it's doing those monthly drug regimen reviews, being available for drug information, going to IDT rounds, and kind of seeing the whole concept of care for these veterans. It's a very unique opportunity, and they do things. There's some great things that go on in the community living center because for many of these veterans, it's their home. So it's a very unique opportunity to kind of see that pharmacy involvement and that role. So it's a good rotation.
What questions do you guys have about any of the VA rotations?
I have a question. Does
Excuse me, in Athens, we can't hear you right now.
Do you have any questions about any of the VA rotations?
I think they can hear you.
Can you hear me now?
Yes. Yes.
Okay. Any questions for us?
I think we're good.
Okay.
Danielle, is she primarily cars or
No.
she's just general?
Primary care now. Yeah. Because there's several different primary care. If you're looking at the sheet up here, it just says primary care. There's just there's several pharmacists in different primary care clinics, all doing the same kinds of things, just serving different areas of the hospitals. We have, thousands and thousands of patients, lots and lots of doctors. One pharmacist can't possibly cover it all, so that's why we have so many of us. Okay. All right. Well, we hope that you guys consider the VA for your rotations.
All right, well, thank you guys so much.
Okay, guys, I'll be right back, okay? We're gonna just say goodbye to our guests. We'll be right back.